Hello guys, welcome back to my channel. This is Dr. Ranjit here. So today what we are going to do is we are going to take a little bit of relaxed time, and we're not going to concentrate on the student in you, which I'm sure that there are lots of people to tell to how to prepare, how to strategize an exam, how to excel in exam. Today I'm going to just talk about 5 minutes on for the doctor in you, because when you guys come out to the community to practice medicine, it's totally a different ball game. And there are few things which I want to convey which I personally feel that every doctor should have, and every doctor should develop in order to have a peaceful and a flourishing practice for you in future. Fine. So the first thing what I want to say is, when you are a student, your aspiration or your goal is going to be, I am going to get a good rank, I want to get a good seat, I want to get in a good college, the branch of my choice, that's all. But this is not what exactly is required for the doctor in you. It's going to be not I anymore, it's never going to be me anymore. In the future, as a practicing person, it's always going to be us. It's a teamwork. It's never ever an individual victory. Any case a doctor diagnoses, a doctor treats, a doctor manages, a doctor operates, everything is a teamwork. For example, let's take my scenario. I'm a pathologist, so when I'm going to diagnose something, let's say a cancer under the microscope, it's not my proficiency alone. I have to be totally dependent on the surgeon who gave me the biopsy. The surgeon should be dependent on the OT technician in order to have everything in place. I have to also totally depend on the OT technician, because once the biopsy is taken, it should be put in a proper formalin where the OT technician, OT staff nurse plays a huge role. It has to come back to the lab. In the lab, my technician should process it properly, should stain it properly, should do the markers properly in order to apply whatever I little bit know to come to a diagnosis. So it's never me. If I'm going to say I am going to do everything, totally impossible. So what we have to learn is, from a student to a doctor transmission, you have to transform from I or me to us. It's a very huge transmission, and I'm sure all of you guys will excel. But when you excel in that, I want to put forward few things which I feel that is a bit lacking here. One is, we have grown up seeing House MD, Dr. House, and unfortunately our mental image of a perfect physician, a knowledge physician, is Dr. House, who is just a figment of a director's imagination, where he makes sure that he's going to put things, he's going to show himself superior and all other subordinates under him inferior. Unfortunately, that is not the ideal scenario at all. See, when you're going to work in a place, you must have seen your professors or someone in your vicinity in the hospital doing this. If there is some staff nurse, let's take for example, has done a mistake, the first thing the consultant yells out at the staff nurse in front of everyone, that is wrong. Yes, he or she might have had a mistake. It's fine, it's a mistake. You should not yell out on anyone in public. You're not dealing with a staff nurse, you're dealing with a human. We generally forget that. It's our tradition, whatever we do from when we grew up. Like for example, you have a delivery, food delivery. A good food delivery, you never even bother to tell him thanks. But a bad food delivery, you go out on the Play Store, you go on the review, you lash it out. The same thing is going to get translated in the workplace, which is going to end up detrimental. It's not good for you guys. It's not good for the team who works together for the patient. You have to change this. In future, if any one of your team, let it be the ward boy, the doorkeeper, your person who manages your clinic, a person who helps, the nurse who helps in you, does a good job, yell it out loud to the entire world so that they hear that yes, this job was well done. Give a pat on the back. Anyone. At the same time, any one of these guys does a mistake, that talk should be privately between you and the person who did the mistake, and it should be within 4 walls. It should never ever go outside. Keep this in mind. Anything anyone does good, it should reach everyone in the hospital. It creates a positive environment. Anything everyone does a mistake should never ever reach anyone, and it should be useful for the positive criticism of that particular concerning person alone. At the same time, be open to your positive criticism as well, so that you also can improve. First thing. The second most important thing I feel personally is, this I have also done in the past. I am trying to improve myself in future. I hope I will become better in the future. Is when a patient comes to you, you must have definitely must have at least been in the scenario. Patient came to you with so and so diagnosis. You look at the thing and say, okay, this is not the correct diagnosis. You know it's not the correct diagnosis. So what most of us first, knowingly or unknowingly, we do is, hey, the doctor or the other hospital has not done a correct diagnosis. No, please don't do that. You are never ever in future. Please take an oath here today, now, in front of me and in front of every YouTube audience. I am never ever going to let my fellow colleague name go down as saying he or she did a wrong diagnosis or management. I'm going to say, yes, it can be done better to the patient, and I'm going to say, I'm going to do it in a different way than what your previous doctor did. And if you're really, really concerned about the patient, you're going to call up the surgeon, he or she, or physician, whoever it is, who made the mistake. Call them and say, come, let's go, let's have a talk. I want to don't say them they are wrong on phone, because it will create a wrong notion. That person is also not going to perceive it correctly. So what you're going to tell them is, come, let's go and have a coffee. This is how you're going to break the news. It's a very, very, very tricky situation when you talk between professional colleagues, especially when you point out the mistakes of another person. Let's assume that I saw a diagnosis done by some other pathologist which is not correct. Let's assume that. Okay, so I'm going to go there and I'm going to call the person. I'm going to say, see, I'm practicing histopathology. Let's say that hey, I have a difficult case in hematology, leukemia. I know you're good in leukemia. Can I just give the slides to you? Can you just have a look and give it to me? See, first, I'm going to make sure that I'm going to build a rapport saying that, yes, you are good in a field, which I am not. I'm going to seek help of yours. Obviously, when you say a person is good at something, they're going to be happy. They're going to be self-content. Then later on, tell that, hey, yesterday I got a slide of yours as well. I think the words are very, very important. I think whatever you reported were due to older guidelines. We have had a new marker in our lab. We did that, and the diagnosis kind of changed. Yours was a very close differential diagnosis. I think you must have done that as well, because if you had the marker in the lab. This is how I'm going to put it. I'm going to subtly say them, yes, the diagnosis you made was an error. At the same time, I'm not going to let the person down. At the same time, I'm also going to give the person, or make sure at least in future, I'll give a case to the person, which I'm not good at. This is how you're going to convey it anytime to fellow colleague. Very, very important. Professional ethics maintenance is very important. Never ever talk bad about any fellow doctor anytime during practice in front of a patient or anyone in the community. That's going to lift up entirely all of society. It's not just you, as I said in the starting of the video. It's never me. It's always us. And these two things which I perceive is very, very essential for a practicing doctor. And I hope that you will follow that in future. And I hope we all as a community will grow to greater heights. Thank you for listening to the video. Bye-bye. See you soon in the next video. Till then, bye-bye from Dr. Ranjit. Bye-bye.